Hi, I'm Julie Welsh, and this is my health policy narrative presentation for the MBA class 721. My proposed legislation is an act to impose financial penalties on all groups considered by tax ID to be insurance payers or subsidiaries for overly burdensome prior authorizations and step therapy, overturning decisions regarding course of treatment by the physician simply based on cost alone, and interfering, overriding, or protecting payment for procedures or drugs, diagnostic testing, or continuation of care when this has previously been deemed appropriate through medical decision-making by a patient's physician. This is federal legislation. A 2018 survey of doctors found that healthcare plans are increasingly overriding the treatment decisions that they make for their patients. The survey found that 89% said they no longer even have adequate influence in the healthcare decisions for their patients, and 87% reported that health insurers interfere with their ability to prescribe individualized treatment. As a result of their frustration, many doctors, and 52% said that they are thinking of leaving the profession, and 67% would not recommend a career in medicine to others. These are alarming statistics. This legislation and the public health policy behind it comes from the fact that it is often said the United States has the best healthcare system in the world. However, its fragmented approach of federally and privately administered insurance programs, coupled with not guaranteeing its citizens any form of healthcare, causes the U.S. to rank poorly in relation to other developed countries. The U.S. spends far more on healthcare than other high-income countries, yet the spending levels rose continuously over the past 3 decades. Yet the US population has poorer health than other countries. As the baby boomer population ages, more people are living with age-related disabilities and chronic disease, placing pressure on our healthcare systems to respond. Timely, accessible, and affordable healthcare could mitigate many of these challenges, but the US healthcare system fails to deliver reliable services to all who could benefit due in part to inadequate or improperly administered healthcare plans. The Affordable Care Act's repeal, among other unintended consequences of recent healthcare reform, have allowed the pendulum of healthcare reimbursement to swing too far in a direction that now gives insurance payers the ability to overstep the boundary between reimbursement and the clinical side of medicine decision-making and appropriate patient care. The target population of this legislation and the advocacy analysis lead to the target population for legislative changes to control insurance companies' ability to overly influence healthcare decisions is primarily physicians and other healthcare providers. However, every patient in the US stands to benefit from giving doctors back some control over medical decision-making. This potentially includes every single person in the US. While insurance companies do not determine care, they do determine what will be paid for. By requiring pre-authorization for treatment, a fail first or step therapy approach, or denying claims just arbitrarily due to medical necessity constraints, insurance companies across the board have removed a large portion of health providers' decision-making power. The providers are forced to order diagnostic testing or prescription drugs based only on what will be covered by a patient's plan, not what may be best for the patient or the fastest or most effective form of treatment. Today, decisions about a course of treatment that were once made by the doctor and patient are being questioned and often overturned by healthcare plans to control their costs. Prior authorization requires doctors to request approval from the insurance company before prescribing a specific medication or treatment. The treatment prescribed will only be covered if the insurance company approves it, based on their own policies, and often without considering the clinical history of the patient. Research from the American Medical Association found medical practices spend an average of 14.6 hours a week just to complete prior authorization requirements that the insurance company impose. The American Medical Association has denounced step therapy, and prior authorization, stating that they find these growing trends towards the use of restrictive and burdensome utilization management tactics by payers concerning, and they urge the Center for Medicare and Medicaid Services to reconsider its stance on this critical patient issue. My legislation proposed will need a new bipartisan committee to be formed and comprised of members of multiple different areas of the government. This committee will serve as the watchdog group when infractions are reported by healthcare facilities and providers, and deliver the fines associated and enforce the collection of the financial penalties to the insurance groups. The financial penalty will be set based upon CPT codes and DRG assignment, as it will be established that certain codes with certain diagnoses do not ever need prior authorization. Step therapy will be eliminated completely with a set dollar amount fine if an insurance company tries to acquire it. Medical necessity denials and overturning physician medical decision-making will be reviewed on a case-by-case basis, and fines assessed by parameters set by the American Medical Association, the American Hospital Association, and other medical leaders. It will be the responsibility of the nation's highest level medical associations to set forth the standards on what is reasonable patient care by physicians and what would be considered an abuse of power by the insurance payers. This will then go through the scrutiny of the committee. Indeed, the AMA has actually developed a code of ethical ethics in 1847, and it remains even today the values to which physicians commit themselves as members of the medical profession. The financial implications of this proposed legislation have the potential to be very far-reaching throughout the healthcare industry. While insurers claim that prior authorizations, step therapy, and non-medical switching and medical necessity claim denials are saving money, this only amounts to saving money for the insurance company itself, if anything. These so-called cost-saving techniques never pass any savings down to the patient, nor provide the healthcare facilities with higher reimbursement. We know that this is true because healthcare costs and insurance premiums both continue to rise in cost every year. Once physicians are able to practice effective medicine more freely again, the door opens to the formation of more collaborative partnerships that may truly improve patient care while actually saving money. Examples of these collaborative partnerships are clinically integrated networks and group practice subsidiary models. In conclusion, insurers need to be held accountable for what is the best possible treatment and outcome for the patient before all else, certainly before their own profit margins. Physicians do have accountability as well in forming the most efficient patient care plan by choosing the most effective and beneficial treatment route possible through their trained medical decision-making. The way medicine is practiced today has become increasingly inefficient while simultaneously becoming increasingly unaffordable. And physicians are ready to spearhead this change. Bipartisan and public support will be crucial to enacting this new federal legislation, but this should be easy to achieve with proper information campaigns. Thank you for listening to my presentation.